Just a quick disclosure to share in conjunction with this podcast. Each of us are speaking to our personal experiences and do not consider ourselves experts and cannot offer medical, therapy, financial, or legal advice. We represent a wide range of experience on the autism spectrum and will always honor each perspective that is brought to our discussions. Our experiences, opinions, and perspectives are all unique and different and will be celebrated. Thank you so much for listening and connecting with us. Thank you. Hello, everybody. Welcome to Navigating Adult Autism. We are just a bunch of moms with a bunch of opinions, a lot of perspectives, and a lot of experience. I'm Mary, and today I'm here with Cynthia, Elizabeth, Tara, and Kara. We're missing two of our moms, Dawn and Heather. We miss you. But the exciting thing is we are on location today, and we are at the Arc of the Ozarks Autism and Neurodevelopmental Center, a place of hope. And we are here with Dr. John, Dr. Tan, and Dr. Lindsey. And we're going to start, and I'm going to introduce them. And we'll start with you, Dr. John, if you can just go ahead and tell us a little bit about yourself and your role here at this center. This podcast is regarding autism and the diagnostic process. So we'll kick it off with Dr. John. If you could just tell us a little bit about yourself.
Sure. Happy to.
Thank you for being here.
Yeah, glad to be here. You. Dr. Kyle John. I'm a child and adolescent psychiatrist by training. But like Dr. Tan, we both have to be adult psychiatrists first. So we're kind of dual boarded, if you will. And about 30 years into my career, did my training here in Missouri at the university, and then my residency up at the Mayo Clinic. And have been back in this part of the state for 17 years now. Much of that was with the Mercy Health System, and now the last year with the Arc of the Ozarks. I'm the medical director here at the Arc, and so I work with the team, taking care of the kids and the adults, and seeing what we can do to help the community.
That's great. Dr. Tan?
Yes. I'm Dr. Tan, child and adolescent psychiatrist. I did my medical school at Southwestern University, and I did my residency and fellowship at the University of South Dakota. But I have a very strong interest in pharmacogenomics, but also interventional psychiatry and really and neuromodulation.
Oh, clear. It's clear. I totally understand where you're coming from. Okay. Thank you so much.
I think you'll hear more about that as the podcast continues.
We're so glad you all are here. Okay, Dr. Lindsey, thank you for being here.
Thank you for having me. My name is Dr. Lindsey Reichert. I am the director here over counseling and diagnostics. So my team and I are in charge of all of the autism diagnostics that come through the center.
Oh, okay.
It's awesome.
That is awesome. That's great. So to shoot off like the first question, when we all, the moms talked and everything, and we're thinking about questions, and this is to whoever wants to answer, could one of you share a brief history of autism diagnostics? I mean, because we're all old, we have older children, so there's, we didn't even know there's like a 1, 2, and 3. There was just, it's changed since our kids were little, but whatever you want to share on that would be helpful.
This is a Lindsey question.
Okay.
Oh, goodness.
Okay.
Go for it, Lindsey.
Thanks. So the diagnosis has changed over the years substantially. So at first we had PDD-NOS, which was pervasive developmental disorder, not otherwise specified. And then we also, within that category, or a subset of that, was Asperger's disorder. A lot of times people still refer to that as high-functioning autism. And so over the course of time, we've gotten better measurements. So here at the center, we use the ADOS, which is the gold standard for assessing autism. And then we also look at the IQ. We also look if there's any medical history and developmental history as well with a diagnosis. Before that, it was really difficult to look at these kiddos and try to figure out, okay, where do they fit? If they don't fit anywhere, we're sorry, we're going to just call you PDD NOS. And now with the latest research, we're actually starting to say, okay, we understand when you see one child with autism or one adult with autism, you've only seen that one. So now it's more of a specialized care than it is just looking at that label, which is really important because we understand that each individual has a section of things that they need to work on, but also huge strengths as well that come with a diagnosis. I always tell people when you have that diagnosis, it's kind of like you're a superhero and you got to figure out where your superpowers are. And typically these kids with this specialized care and treatment actually do really well as adults. And then also adults being able to be empowered by what they do really well and finding those, areas of interest that they just gravitate towards really helps them. So going back to the history, I felt like we gave a label, but we didn't have the treatment and we didn't have the care that we have now. And now we realize if we take the time and we really look at what an individual needs, we can really assess them properly this time around. And then also look at how does that diagnosis look in treatment? What kind of treatments do they need to really benefit later in life?
Wow.
There are multiple tests that can be used. We use the ADOS because we consider it the most accurate. It's in its second. It's technically the ADOS 2, and they're developing the next version of it, the ADOS 3. I don't know when it'll be out, but I know that they are already working on that. There are other ways to diagnose autism in addition to the ADOS, but we feel like it's the most accurate. There's the
CARS, right?
The CARS.
Oh, yeah, the CARS. I remember
which
that.
is the
ADI.
The ADI, yeah. And different autism centers may use different tools. We just feel like the ADOS is the gold standard for us. The other comment I was going to make is that now, Dr. Reichert mentioned, Lindsey mentioned, terms like PDD NOS and Asperger's, and gosh, this is back in the day when we used to have Rett syndrome, right?
Yes.
So it's all that was, and now it's just pretty much autism level 1, 2, or 3 with or without intellectual disability. And I want to mention that at some point too, in terms of the diagnosis, how that's kind of changed. And so the 1, 2, and 3 reflect the level of severity or impairment that the person has from their autism. And so the other comment that I was thinking as Lindsey was talking was how people often ask us, why is the incidence of autism, why is it increasing? Why is it 1 in 36 now instead of 1 in 96 or whatever?
That was one of our questions.
Yeah, absolutely. And part of it comes down to what Lindsey was talking about in terms of we not only have we have better screening, and we'll talk about screening because it's an important topic. We have more people who are trained to diagnose autism, and so we have more people recognizing and doing the testing, and we actually have broadened the criteria for autism over time.
Oh, have you?
So, and I'm not a great history buff in the sense of when exactly did that happen 5 years ago, 10 years ago. But if you read the experts, they say that over the, maybe the last 10 to 15 years, as we've broadened our definition of autism, and you see that maybe a little bit with each version of the DSM, the Diagnostic and Statistical Manual. That's that book of all the psychiatric diagnoses that we use. And you look how it's changed from DSM 2 to 3 to 4 to now 5, you can see that the symptoms have changed a little bit, how we define it. And so I think those two things really in the literature get tapped as to why the prevalence of autism seems higher now. Is it really more people having autism? And there may be some of that, but there's also, we're better at screening, testing, and our definition or the criteria have changed just enough that our current figure, and Lindsey or Raymond will correct me if I'm wrong, but 1 in 36, and I don't know if that's a national or a Missouri.
It's a national.
Okay.
Well, just like when I know, when our children were diagnosed, so my daughter was 1 in 400. And by the time my sons were diagnosed, it was 1 in 92 or 94. And the boys are 18 and 21 now. So I don't know if that was kind of the same.
Same. I remember like 1 in 300, something like that. Yeah. Right. And my son's almost 32. So, wow. Okay. Do you have a lot of adults coming in requesting diagnosis? How has that changed? It's not just little. I mean, back in the day, it was a lot of little kids, but now, do you have a lot of adults coming in for assessment?
Yes. So we see across the lifespan here at our center. We do have littles come through, and because pediatricians are starting to recognize it sooner, that's where I think a lot of our kiddos are coming from, is pediatricians now have that education behind them to say, okay, these are symptoms that I'm seeing, instead of it just saying, oh, well, they'll grow out of it.
He's a boy.
Yes, or he's a boy, right?
I heard that a lot.
We hear that a lot as well. And so now they're saying, oh, you know what? There are some concerns here. Why don't we go ahead and, look further at this, or have a psychologist come in and check this out? And so when that happens, we do get the littles, but we're starting to see more and more adults. And I see the olders that come through. My favorite are the young adults, right? Because they've been through the school system. It has been a struggle. They have no idea what's wrong with them, but they know something's not quite right because, they're trying to hold down a job. They can't quite hold down a job. They don't understand why their friends don't have problems wearing certain material that's stylish, right? They also don't understand social cues or why they can't keep friends. And so they're seeing all these struggles, and they come and they're just like, I have no idea, but I think this might be it.
Oh.
And so we're like, okay. So the adults are a little tricky because, across the lifespan, we like to look at the developmental history. And so some of these young adults, they don't have the developmental history access because some of them, don't have the greatest relationship with the parents, or the pediatrician isn't their primary care anymore. And so they don't have access to that. So what we do try to look for is like, okay, if you have a family member that has been with you, bring them in. Let us talk to them. Right. Let us talk to your primary care and see what they have to say about it. And then also we look at trauma. We also look at anxiety, because a lot of these young adults have a lot of anxiety because they know, like I said, something's not quite right, but they don't know what it is. So they come in with depression or anxiety because the adjustment into adulthood has been significant. I mean, for us, it's hard, right? But then for a child that's neurotypical going into an adult world, that's a real struggle. And so we've been seeing more. And then recently, we've been seeing parents of kids, because they're like, my kid just got diagnosed. I think I have those symptoms too. This totally makes sense now. So we've been seeing those as well. But my favorite are kind of the in-betweeners, right? So the ones that have been adults for a while and just are like, something's not right still. And they come in and we're able to get that diagnosis, and we're able to help them with the treatment of it, right? Like, hey, we get it. Middle school was probably super rough on you. Right. There wasn't all these, extra accommodations made for you this entire time. Let's look at how do we navigate this moving forward. And it is like this huge hope that they have of, oh my goodness, I don't have to go through life alone anymore. Somebody gets it. Somebody understands.
Wow. It's got a weight lift off them.
Yes, absolutely.
And what does that look like? What kind of care do you give them? Like what is there, if a young adult, like you were just saying, came in, what is one of the first,
yes.
How does that start?
So what we look at is where their needs are at. A lot of times, depending on where they're at on that spectrum. So if they're not able to be their own guardian, that looks different than somebody who is out on their own independently. So the independent ones we set up with our family advocates. Elizabeth is like the best one ever, that help kind of navigate through, jobs, housing, whatever they may need. But I've seen the most growth coming from therapy. So just even talk therapy, being able to sit down with another professional who understands and being able to talk through that. The other thing that the ARC has started implementing is group therapy as well. So being able to sit in with other adults on the spectrum.
That's a good idea.
Yes. And be able to talk about like how life was and where life is headed and, and looking at how they utilize coping skills. I mean, these people are super resilient. They have gone through life with no, accommodations and have made it to this point.
Right.
And so being able to share those experiences is so beneficial.
And so you kind of already answered this, but if a parent said, they're kind of in a situation, they're like, well, they've made it this far. Do they really need a diagnosis? What would you tell them?
So the diagnosis is, yes, it is a label, and yes, it doesn't define who they are, but it sure does help when you go to look for services. It sure does help when they're going and they're doing research and they're like, oh my goodness, this is me. I do fit in here. And it helps. It's kind of like the idea that it kind of helps identify kind of where you're at, where you're headed. And then also it opens up these doors that they've never had before. Like, oh, I can go to this group because look, they also, have a similar diagnosis and may have similar experiences to help me. So I'm always like, hey, the diagnosis is not the end all be all, not at all. But at the same time, it does help explain some things and it does open more doors.
That really makes sense, because I know when families ask me, they say, well, when do I tell them they have the diagnosis? And I would say, well, is it doing more harm not knowing? Is it, I have no friends because it's just me, or I have no friends because I have autism and I need to learn social skills and, I can do that. Where I kind of think that's part of what you're saying.
Absolutely. I mean, when you are an adult and you realize, okay, I've struggled with relationships my entire life, and now my marriage is on the rocks. What am I going to do? We've been to marriage therapy. That doesn't quite work. But then if you're like, hey, guess what? You're on the spectrum. This is why you probably think that doing the dishes is a sign of disrespect. And this is because in your brain, that was the rule that you made. And that's the rule you're sticking to. And so it kind of opens more doors of understanding. I always tell, people who are on the spectrum, a neurotypical brain is like, a Post-it note. It's square. It's flat. Your brain is a Rubik's Cube. It's constantly moving, constantly thinking. You're constantly looking at all these different angles. Your partner and your friends need to know that.
Yeah.
Because when you say, hey, I don't like to go to that restaurant because it's too loud, you're probably not going to have fun, even if your friend's like, come on, let's really go. It's not going to be fun for you, So really understanding and setting boundaries too, and understanding that it's okay to set those boundaries.
Well, because in that particular situation, they might misinterpret it as, I don't want to be with you.
Right.
Yeah,
Absolutely.
Or I'm embarrassed to be with you. I don't care about your feelings. What they're saying is, it can be so much better if we go somewhere else.
Yes, absolutely.
Or they blurt it out. I'm not going there. It's
Right.
too loud.
Or they're really blunt and they hurt their friends' feelings. It's like, okay, we understand where you're coming from.
Right.
I have a quick question.
Yes.
What about seeing someone that already had the diagnosis at age 7 of Asperger's and he has epilepsy and never had any kind of services at the school district he was in, so we always flew by the seat of our pants. He was in counseling from the time he was 8. And the therapist that gave him this diagnosis, which is Dr. Linda Smith at that time, she said he'll need lifelong counseling. And we did stay with the same counselor for years and years, and then she retired, and he didn't really want to see anybody else. But for him, so now he's struggling and going out and getting into the adult world, though, with jobs, because he wants to just do animals. And he got to do that for many years. So can they come here to get help, too? I mean, we've got all the developmental stuff. We've got stacks and stacks of everything, documentation.
Oh, absolutely. You don't have to have an autism diagnosis to seek therapy here at the ARC. And the Asperger's diagnosis, again, would have fallen under the autism diagnosis at this point anyways. But yes, and we definitely have those group therapies. I think that would be really good for him too, because you make friends in there, and then you can have a friend outside of therapy as well there to help guide you.
Well, and you see those changes from we need help for our child to navigate school, middle school, high school, to now how do they navigate getting a job, getting an apartment, whatever. And of course, sitting next to Elizabeth here, I mean, I can't tell you how many times a week I write, we'll have Elizabeth Obrey contact the family to, because that's one of our family advocates, as Lizzie pointed out the best. She's an expert in helping those families through those kinds of steps because the needs are different. Getting a job or getting an apartment or even college is a lot different than writing an IEP and making sure that the schools are doing what they need to do to help the child be successful. And it's exciting, I think, to see kids get to that level. I was visiting with a family this past weekend at the Autism Blast out at the mall, and it was a child that I'd cared for when they were younger, and now they were older, but it was exciting because they were having new struggles, and I reminded them, time is on your side. If the normal brain, male brain especially, takes 25 years to mature, think about your 18, I think he was 18 or 19-year-old male son with autism, and actually he was doing great. The family was doing great. They thought they were really struggling. I'm like, you guys are way ahead of the curve here, really. But that time he's going to need every day of 25 years and then some, because he's developing at his own rate and pace and that type of thing. So, reminding young adults and their families, their caregivers that, don't, what you see is not what you get at 18, maybe at 28 or 38, and not that growth stops then, but, my point is that that age range really needs time to grow and develop. Yes. And, maybe they drive at 22 instead of 16, but guess what? Now they're 22 and driving. And that brings a whole, level of independence that, or maybe they've learned to navigate the bus system at that point or whatever. But finding that job that really fits and sticks, that's a big deal. That's one of the goals with our patients and their families is to really get them as independent as possible, which is why early diagnosis intervention matters so much. But we want them to live their best life and be as independent as possible. And at every level, that there is probably something that we could offer here at the ARC and lots of other folks in Springfield too doing that important work.
So if you have a diagnosis, they can just call up here and ask for therapy?
Absolutely.
Okay, well, that's good
to know.
Yeah, we have a new website, Autism Center of the Ozarks.com.net something.
Great.
But and there's, when you pop open that new page, it's only been in use now 2 weeks. It's like refer my child or refer my patient. So it's a one-stop shop for providers, therapists, doctors, whomever, or a family member, or the patient could refer themselves. And tap on that, and you put in some information, and then you're going to hear back from the ARC. Hey, fill out this intake form is what we call it, so we have the information that we need to figure out what services might be best. And somebody like Elizabeth or one of our intake folks will screen that information and then reach out to the patient to say, hey, here's what we think might be helpful.
Okay.
And
I just
Autism Center of the Ozarks.org.
Oh, .org. Thank you. Yeah, sorry. Okay. Shame on me for not knowing it yet, but take it away, Raymond.
Well, I just wanted to say that other than just focusing on autistic spectrum, but equally as important is the comorbid conditions that occur with it, which also is extremely important to not only diagnose it, but to also know how it can be alleviated, not only through therapies, but also even medications can play a role. Because sometimes when it's so severe, you'll not be able to be talked out of it. They cannot even participate enough in the therapy to get the most out of it. But the assessments need to be in areas of like anxiety, anger, depression, ADHD, their language, like that, in multiple directions like that. But again, in combination, multimodal, if it's necessary to have medications on board or not, but also the different therapies that can be helpful, like areas of like behavioral and cognitive and social flexibility, because a lot of it is like sometimes they get inflexible and they're rigid, but if they learn some skills to go outside the box or something that they know that there's a go-to person that could help them out, then they'll feel like maybe their challenges are not as overwhelming as they could be.
Correct.
That sounds like a good topic for another podcast.
It does.
So listeners, tune in to a future podcast. You'll hear more from Dr. Tan about.
Not only
Definitely.
like a job setting, home, work, but Kyle also hit it too, and that was those that are in college and what to do like when they live in the dorm or where to park.
We've lived that.
What can I get out of the library?
Yeah.
Like that.
Or if you have problems in a classroom, how do you approach a professor?
Yes.
Yeah, all kinds of things. No, I think as young adults, that's very helpful to know that, because I think that sometimes there's a misinterpretation that they have a job and they can live on their own, which is fantastic, but there's also problems
Yes.
along the way. So I feel very hopeful that they could just come here and get therapy for it and help them through that.
And one thing I did forget to add was we did get to come see Dr. John, and he helped him tremendously, and he found a medication combination that really worked well.
Oh, good.
But we missed him once he left Springfield.
Well, it's better to be lucky than good, and I'm glad to be back.
I feel like as a 20-year-old, my son is 20, what you said about like it's going to be different at each age, I feel like I just need that recorded and put on a loop in my household, because every day he's like, it's not going to get better. It's not going to get better. And because he is a little bit rigid, he doesn't want to try things again. So like he's tried a social group or something like in the past and it hasn't worked out. And but I'm hearing about adult groups. That seems like a really cool thing for him, and I think he would like it. He is going to try your interns group, and they met the other day, and he loved it. They're going to Silver Dollar City soon. Yeah, Infinity Circle. But how do you get someone on the spectrum to try something again?
So the best way I try to do this is using an analogy, right? So you can always tell him, listen, when you started walking, you took one step and fell over. And if you would have stopped at that point and said, I tried it, it didn't work, we'd still be carrying you.
Yeah.
But the fact that you
That's a
were
great
able to
analogy.
get back up and try it again, and now you walk everywhere. In fact, you don't even think about it. Like your feet just hit the floor and you move from one side to another with no problems. This is what happens when you keep trying. And, you know, the ARC, we did a great job with this, the therapy team did, where we started looking at the research and started looking at these social groups. Because guess what? Social skill groups, a lot of them don't focus just solely on autism and neurodiversity, right? So you can be up there talking, but it's not registering to anyone.
Yeah.
So what we did was we looked, the peers group is actually a group specifically designed for those that are on the spectrum or neurodiverse. And we have it set up for our young adults. And so it covers everything from relationships to college to work. And so it really helps them bond in that setting.
You call that the peers group?
The peers group. It's
Okay.
PEERS.
Okay.
And that is here at the ARC. And not only was it a great success with our young adults, we also started doing it with our adolescents as well. So we've really tried to approach this a different way, and understanding that our programming may have to be a little different and tailored to the population that we're trying to serve.
I see.
Can I ask a question about that?
Yes.
So like, is it level ones? Because my son was not before the levels. Is it level ones together? Okay, so I've said this before on the podcast,
Yes.
but my son has a problem with
People with
being
disabilities.
with other disabilities.
My daughter does
right.
too.
It's
She doesn't
very
want to-
frustrating.
That is actually
So
a
does my
common
son.
thing that we
Okay.
have talked about.
Okay.
So what we have actually done is we've accepted everyone into the group. The cool thing is they're seeing a therapist here. Their therapist actually can go and sit in with them the first time. So it's not as scary. The other thing too is we've been very cognizant of that type of situation where I don't want to be in with this person because I don't know what they're doing over there. But
Yeah,
you know,
he can't
it's-
handle anyone stimming next
Right.
to him or
And, you know, so what we've done is when you call up and you ask for these groups, just let them know that ahead of time, because what we've been trying to do is group them into certain classes to where it's like, okay, this person, you know, may have ADHD, but this person over here is high functioning, autism. But if this person is constantly moving, it's not going to go well across there. So what the therapist will do is kind of put them in certain situations within the room, or they'll wait till another group starts to put them in to match them better. So we've really been trying to work with that. The idea is the second round, because you can go to several different rounds of them. What's really kind of cool is the ones that, were very much like, I can't be next to this person because, they're bouncing off the walls over here. They've actually had built up a tolerance with it, because one of the things we teach is, hey, we need to be accepting of everyone. Yeah. We understand what it's like when people don't accept you. We need to start being accepting of everyone.
Yeah. Yeah. Gosh, that's wonderful. And I think we all try to figure that out as moms, to how to build up that tolerance, because we want kind and wonderful children, of course. So we have to, we try all the time, like, you can do this. You can do it for 10 minutes. We slowly build it up. Yes. So, I mean, it's definitely our goal, but, we want everybody to be comfortable. So.
Absolutely. Well, my goal eventually is hopefully like Love on the Spectrum ARC style, right?
Yes. I love that show so much.
Yes. We'll throw some marriage and family therapists in there along with the other ones and be like, hey guys, we got this going on over here.
Yes. That's a great show. Yeah, I had my husband watch that not too long ago, and just kind of reassurance for husbands out there too. That might be another topic. I think it is another topic for later. But it kind of just made him feel like, see, we're not the only ones out there, with the child. Because sometimes you get stuck in your own head and you're at home and thinking, is anyone else going through this? Which is another reason we started this podcast. But that was very reassuring for him and for me to see, because you kind of, I don't know if you picked out your child, but I've like, oh yeah, my son's like Connor.
I also picked out who I want him to marry. Right.
I know. Even,
I want Zion to marry Abby.
I know my husband was like, maybe he should call her, and I'm like, I don't know how to get a hold of her. Okay.
See, now in the peers group, guys.
I know.
Yes. Which was my next question, because you've talked about the peers group, the Infinity Circle. So, what other services does the center provide? And in comparison, like to any others that have been in Springfield, this is such a unique center. We're so excited it's here. So can you touch on that a little bit?
Absolutely. This is a really unique setup. And one of the things I absolutely love about the ARC is we're really innovative. So we try not to get stuck in the same thing, and we try to look at, how do we do it differently? How do we do it better? How do we provide more access? And so we've got the groups going on. We've also got individual therapy. We are starting to do like a co-treatment. So there's been a couple of times where I've had someone that would really benefit from occupational therapy at the same time I do my talk therapy. And guess what? It worked wonders.
I can see that.
And so we are starting to partner up with the speech therapist, with occupational therapists. And so you get, it all together, which is amazing.
Which is your awesome sensory room.
Yes.
What do you call it? Sensory gym? What do you call that?
It's the gym. That's
gym.
What we call it.
Okay.
It's our hangout, let me tell you.
It's great.
The swings are amazing, let me tell you.
Okay.
Yes, and then
So if you can't find Dr. Lindsey, she's on the swing.
I am. I'm in the gym. The other cool thing we've done too is we have feeding therapists. I've actually sat in on some of the feeding therapists, and they've had behavioral issues, right, with kids, and so they call me in to consult with. So we've really tried to make it a comprehensive treatment team here, and we continue, like I said, to be innovative. So I think one of the things that the ARC does, going back to your question, does offer is we do offer the groups, we do offer individual, and we also offer the co-treatment as well. And then we have the diagnostic side of it as well for the autism diagnosis.
Can I ask you on the diagnostics? Our kids are older. They have the PDD, NOS, Asperger's. Is it beneficial for them to come back and get reevaluated as the 1, 2, and 3? And if so, would it benefit them?
I don't really see a benefit unless it is needed for like insurance purposes.
Got it. Okay.
Because PDD, NOS, we're already recognizing is that spectrum anyways.
Okay. Because I know my son is still covered on our private insurance. And just recently, they wanted something filled out from his doctor, which was his internist at the time. And I'm like, oh my gosh, well, he he wasn't around when, but the doctor was used to it. And he told me, don't worry about it, and even early on when he first met my son, I said, would you know anything was wrong with him? And he goes, well, not at first, but once he started talking, and I had some questions, I knew something was a little, go ahead, Dr. Tan. Yes.
Mary, I just want to mention that there's technology that even at a very young age, I can't remember if it's like 3 or younger, but some autism centers are already using it and helping their assessments, and they use precision like AI and eye gaze technology to assist that. I'm aware of already 2 of them that use that, but I that's where innovative technology can be very helpful because they look at a database of normative and then they compare if there's atypicality of the ideas. Yeah.
Okay. I guess they just went along, at that time, I just had my original paperwork, and showed it to my internist, and he already knew that there was a developmental disability, and he signed off on it, to get him covered for. But I think that goes along with the question, do we need to change anything? But apparently not, but diagnosis-wise, but.
I will tell you a common request is for a reevaluation of a child. And at our center, we've kind of put a hard no on that because we have so many kids that haven't had the opportunity to be assessed one time that it's hard to put somebody who has been through testing and for whatever reason they don't agree with the diagnosis, the family may not, that they want testing again. And we're not above reviewing testing and to try to give our thoughts about whether it was accurate and complete. And sometimes we may go, no, your child didn't get a full evaluation, so we can include you in our group of patients that we would like to test. But a lot of parents, well, not a lot, but there are parents that disagree with whatever diagnosis one way or the other. I don't think my child actually has this, or I think they got it wrong, and they want our team to reassess them. And it's difficult to tell those folks no, but we just tend to explain that, look, we've got 300 to 500 families waiting to have their child assessed or adult assessed the first time.
Right.
And it's just hard if they've had good testing. And there are other places here in Greene County and in our region where testing is occurring. So we're not saying they can't seek it somewhere else, but we just feel like right now it makes sense for us to focus on kids and families that have never had a single assessment. So
yes.
The diagnostics 1, 2, and 3 that you said that it detects impairment. As they come here and they get better and they have their therapies, do you retest them, or do those impairments 1, 2, and 3 change, or will they always have that 1 or 2 or 3?
No, it does change. My own nephew is a good example of this. He was diagnosed at the Thompson Center when he was young, and they gave him moderate or 2, and I was kind of surprised by that. And he's a sophomore in high school now, and he's thriving on the quiz bowl and on the marching in the marching band. And he's found, as he told me last time I saw him, I found my peeps.
Awesome.
Yeah, and it turns out it's the band. And
I love that.
This kid's superpower is marching. He can march backwards. He could probably do it with his eyes closed. He's got good, body awareness, whatever. And he loves it out there on the football field when the band is marching. But if you met him and you referenced this, you probably wouldn't know he was autistic until you talked to him for a while and he brought up trains or one of the old Microsoft whatever systems, and then you kind of go, okay, there's something a little different, right? But yeah, clearly has improved. I don't think anybody, if he would evaluate it today, would call him moderate or level 2. They would say he's mild.
I see. Okay. That's interesting.
Yeah, and you don't really have to retest. I'm looking at Lindsey. You can just indicate in your notes that while at one point this patient met criteria for level 2, 3, whatever. Now we think they're this level.
Yes.
Okay. Maybe
Dr. Tan?
instead of doing full autistic spectrum eval. It might be just an area of like adaptive functioning that you just might assess for.
Yeah, that's a good point. In which case, I would get them over to Lindsey's team to say, "Hey, what do you think of this testing? And is there anything we have to offer for this family? That's outside of a full reevaluation."
Gotcha. What about schools? There's a question here about school diagnosis. I mean, I know
Oh,
that
man.
schools
Oh,
can diagnose.
I
Just
love
opened a
this
can.
one. She did.
So I'll start, but then I'll
Yes.
be quiet. But
No, that's okay. Do
you
talk
all
about
know
it.
that there's medical autism and there's educational autism?
Well,
Yes, we've heard that. We've
Yes.
heard it in our IEP.
I used to work for the public school system. So I was even surprised at that when I saw it, that there was a school diagnosis. And I thought, But I mean, I used to work for some school psychologists. So I mean, I get it. But I do know that there are a couple times supervisors had thought that it was the wrong one, that wasn't correct. So I always wondered about that. But since I worked there, I just kind of.
Yeah, no, and we've probably all been in those situations or known somebody in that situation. And now, first of all, there's not educational and medical autism. There's just autism, right?
Right.
The real issue is whether the school recognizes that the students' symptoms of autism impair their ability to learn. And in their opinion, if they don't, then they have medical autism. And if they do, then they have, quote, educational autism. In other words, if the school doesn't feel like whatever. So you could be bright, right? These kids can be bright and they can do well academically, but have terrible social skills. And the school tells the family, we're not going to do anything.
Yeah.
Why would we do anything? They learn just fine.
Right.
Well, but because
Yes.
they can't handle going into the bathroom with the kids, or they get picked on or bullied or whatever.
which is part of the school environment.
Right. Exactly. But I think, and this is just my opinion at this point, I feel like schools are so overwhelmed these days, and, that they have limited resources as well, that they have kind of decided to put on blinders and decide if the symptoms of autism are impairing the ability to learn, i.e., learn the information and pass the test, whatever, then we're not going to recognize it, because then we're responsible for all those other things that the child needs to thrive. So do I agree with that? No. Do I understand it? Maybe at least I understand it. Lindsey, I know you have some thoughts.
Lindsey, do you have thoughts?
I have a lot of thoughts. And I'll keep a lot of my thoughts to myself. But one of the things that I do want to say is I'm very thankful for the ARC for giving this position, to me to be able to have this capability, because what I'm hopeful is to change the future for these kiddos and these school systems in the surrounding area.
Aw.
And how we are trying to do that is we are trying to reach out to every single school system around here and actually talk and build relationships with the people that determine whether these kids get an educational diagnosis after they've received a medical diagnosis, and really try to get a working relationship. What I have seen, I also was able to go and observe the autism clinic through Mercy at the Autism Center there. And what I have found out was their school system doesn't really play ball with them either.
Mm-hmm.
So if they have
And
a
this
medical...
is in St. Louis.
In St. Louis,
Yeah.
right. The St. Louis County. And so I was just kind of like, when I came, back to Springfield area for our clinic, I was like, I'm going to change this for these kids. If they have a medical diagnosis, I'm really going to build those relationships within those school districts so they understand this is a quality diagnosis. And if they have any questions, they can feel free to reach out, and maybe we can start a working relationship. Also, these schools, I understand they're overwhelmed, but they have psychologists there that do the IQ testing, that do the achievement testing, that do the adaptive. Great. Can we not have a working relationship and you call on a medical psychologist to come in and help you determine, yes, this child meets criteria for autism, not only medically, but also academically as well. And so I know there's a lot of kids that are falling through the cracks right now, and I really want to make it to where we can start building great trusting relationships within the school district so we can impact these kids, because yes, they may not have a problem academically, socially, sensory wise. We have to be on the same wavelength here, that these kiddos are going to need extra accommodations. Maybe not now, but maybe in the next couple of years. Why put them through all of this when
Definitely.
we could have prevented a lot of this from happening later?
And we've taken a couple of concrete steps with our program to do that, and I'll give you a couple examples. We're in May, we're going to launch our, I don't want to call it a board of directors, but our board here at the Autism Center that will include members from school districts, parents, the hospital systems. We want
That's
to
fantastic.
receive the feedback
Right.
from those folks. We want to hear their thoughts, how we can partner, how we can work together more effectively. So we're excited about that. We have worked for many years now with Missouri State and with some outstanding experts at Missouri State. And this goes back, 10, 12 years.
10 years, yes.
Yeah, working with Dr. Linda Garrison Kenya. She and we did that purposefully because she is an expert in the school systems and how they see these kids. And so we don't go into our testing in an adversarial way. We want to test a child and write a report that then can be presented to the school district, which speaks their language, if you will, about how we believe autism can negatively impact, or the symptoms of autism may negatively impact a child's success in the school, in the educational environment. And we want to do that up front in the language that the school district or the specific school appreciates. And not everybody that diagnoses autism does that, but it's an intentional thing. We want to write our reports. We want to include the information that we think the school districts need to go, yeah, this kid has autism, and it definitely is going to impact their ability to succeed here. Thank you, Park of the Ozarks, Dr. Reichert, and we can take the ball and run with it. It's not necessarily our job to tell them what to do, but it's great if we can start on the same page. And, sometimes we're going to have to agree to disagree. And we've got people like Elizabeth here who helps us fight those fights when we disagree. And we do that often. And that is not a bad thing. I mean, every time we do that, we do it because we care about the child and the family, and we want them to have a good experience. Again, if we don't do it early, we tend to pay for it later.
Absolutely.
So yeah, we I think the Springfield School District is still the largest in the state. And so it's a huge district. And then we've got Ozark and Nixa and, Rogersville and all around, right? We've got all these terrific school districts. We want to be partners with them. We want to make their job easier, not more difficult. And so we're intentional about that effort and those relationships.
We had evaluations from the Thompson Center and KU Med Center just for our school. And we were outside of Springfield, and they still always said that academically he just, standard deviation test scores were always there, come back, and just never, and they just didn't get services, didn't get anything. But then he pulled out in 7th and 8th grade because he didn't want to live anymore.
Yeah,
So-
and it's a great example of academically he did well learning, but scholastically or in that educational environment, it was difficult.
I mean-
and if we had had some appropriate interventions,
Right.
accommodations.
But we always paid for tutors too, though, outside, like for math and
True.
science. So
True.
we did another thing just to get him to do
did
better.
Yeah.
And there's some legality there because they're not supposed to be denied 504 IEP based on good academic standing.
Right. The other thing that we're doing too is we've partnered with Head Start. And so our pilot program actually is this month, where they have identified several children within the Head Start program that may need an autism evaluation. So we are working with that family advocate that was assigned to that Head Start family, and then also Head Start. And so we are actually going to be evaluating their kiddos I think we're going to do that quarterly.
Wow.
July is going to be our next big one after this pilot. So we have about 30 to 40 kids that we're going to be evaluating through the Head Start program in July. So, I mean, the idea is, like I said, to build these partnerships and have a great working relationship out in the community, because I can write reports all day long and I can assess kids all day long. But the thing is I need to make sure that just because they meet criteria here, great, did my job, but I didn't really if nothing changes for that kid out in the community. So really trying to take care of every single person that comes through our door to make sure that they get the services and accommodations they need to be successful.
Gosh, that's
I
awesome.
love that. I was a family advocate at Head Start.
Yes,
And I've worked in Springfield and Ozark, and I can tell you Ozark was a lot easier to get my kids referred because being an autism mom, I could see it very quickly. And then, of course, we tested at Head Start, and then we would refer to the school district. And it was a little difficult in Springfield. It was a little bit more difficult to get the child services in the Springfield school district than in Ozark. So I'm so excited that you're partnering with them.
Start.
That's it, with Head Start. That's so cool. I love it.
And such
We're
a
really
relief
excited.
to parents, because I just remember going through this for years and years, and just the waiting list. You always heard about the waiting list and the waiting list, and couldn't get services till there was a diagnosis, and parents just waiting and waiting. So you guys are doing awesome.
Well,
here.
and that speaks to the heart of what we're doing in Dr. Reichert's team. So there are 6 state-approved, state-funded autism centers in the state, and we are becoming number 7, if you will. There was no other state-funded or state-recognized autism center in this part of the state. That's not to imply that there aren't places to be assessed here in Springfield and surrounding areas, but there's a program in Kansas City and a couple in St. Louis, and of course the Thompson Center and a couple others. But you know, there is it's not unusual to hear a year or 2 wait, and so we set a goal for ourselves this calendar year to try and assess 500 children or adults to complete 500 evaluations for autism. And really, we have our sights set beyond that. But that would only make us the 3rd largest center in the state if we're successful at seeing 500 patients and completing a screening and assessment and determining yay or nay. But it's a big deal because people from this region were driving to Kansas City or Columbia
Correct.
or St. Louis,
Yes.
and we want to keep them at home. That's another thing we do at the ARC. While this is our diagnostic hub here in Springfield, we have goals to provide services in Joplin and Bolivar and Hollister and Lebanon, and we're already in Joplin and Hollister or Branson area, but goals to expand beyond that so that folks from those areas don't have to drive all the way to Springfield several times a week if their child needs services. So kind of the hub and spoke model for this region is our goal.
Right. That's fantastic.
The other thing we're trying to do too is, instead of just putting somebody on a wait list, we say you don't have to wait. So as soon as you make contact with us, let's say your kiddo is having some difficulties in school and experiencing anxiety, not a problem. We'll get them touched in with counseling. And that actually expedites the process because it allows us to have eyes on the kiddo before they even come see us. So we have all this rich data as well as an evaluator, but also you don't have to wait.
That's
You
great.
can come on in and you can get services that day. We don't need that diagnosis to give you a lot of our services.
Wow. That's great. Dr. Tan?
I've talked with Dr. John before about a hub system where it would be helpful that, let's say, they could identify within the 7 or 8 autism centers which one would have like an opening earlier, and then could tell the families in a centralized form that if you can't wait, but this one is available, might be further away from, but at least it's earlier. Would you want to take that? I think that would be helpful as well because, like waiting a year, that is just painful to hear.
It's a year wasted.
Yes,
Absolutely.
right. And another thing that is helpful is like I brought up earlier about precision diagnostics, is that there is some pilot programs that claim that they can assess and to improve like assessing autistic spectrum like 2 to 3 times than what you can do now. So that matters as well too, and that is something that I am bringing up later this year.
Great.
Awesome.
Elizabeth, were you going to say something?
Yeah, and I mean, it was, I liked what Lindsay said, because a lot of times, some of the things that we're hearing through the advocacy office is parents are being told, well, we can't start anything because we want to make sure we do the right thing. So let's not do anything. So you're saying the opposite.
Absolutely. It's important to put services in place as soon as you recognize that there's some difficulties going on. I mean, the idea is when I assess, it just gives me a snapshot of what the child is doing right then and there.
Right.
But if you put them in therapy because they're anxious or they're depressed, why not start getting some of that treatment right away? That's not going to change that outcome one bit. In fact, that actually helps us because that gives us better data on what is actually going on. And I can actually start this was the baseline before therapy. This is the baseline during therapy. Wow, this is working for your kid. Definitely going to put that part of the recommendations. But nobody has to wait. The idea is go seek out that professional help right now because your kid needs it. You need it. I mean, parents, oh my goodness, sometimes they just need somebody to say, hey, you are doing a great job.
Yes.
These are some difficult behaviors. I know as a mom, I always tell people I was a good mom before I had kids. Man, my hypothetical kid was great. All these parenting classes I took and got, trained in, I was awesome. And then I had kids and I'm like, oh my gosh, they're like ducks and none of them, they're squirrels and, nothing's in a row. Okay. Nothing.
It's not going according to plan.
And so somebody with a kiddo on a spectrum that comes, they're like, Lindsay, I do all the parenting skills. I've taken all these classes and none of it works. And I'm like, well, no wonder. I'm a trained professional and, the kid won't even sit for me. So I got nothing. No, I'm always like, hey, we're in this together.
Right.
Because that's the huge thing. That's where you see the huge improvement is if you can get that parent to say, hey, you don't have to do this alone. You got somebody in your corner. Your kid's got somebody in your corner. I may not know if they have autism or not right now as a professional, but I can tell you your kid's depressed or your kid's anxious, and I am going to be the touch point for your kid and for you. And we are going to advocate together.
Wow. That's a great
so
way
good.
to even wrap up this podcast. That's awesome. But I do wonder if you guys have any last thoughts you'd like to share, our 3 specialist doctors here, before we close up this podcast on autism and the diagnostic process,
Or even maybe some future plans.
Yes. Yeah,
Well, I'll start with just if there's a parent that's concerned about their child's development, start with your pediatrician or your family physician. It's a great place to start.
Okay.
As I mentioned at the top of the podcast, we're doing much better at screening, and Dr. Tan has alluded to some technological options that are coming down the pike, so to speak, that may help us significantly. So start with your primary care provider. Hopefully they learned what I learned early in medical school, which is always listen to the mom, typically the mom, but the parent.
Nobody standing ovation.
Nobody knows their child better. So if the mom says, I'm concerned, then the provider should be concerned. Now, I get that sometimes there's an anxious first child, right? And we don't know anything, and that included me with my first. But yeah, listening to the parent and going through a thoughtful evaluation of the child. And then if they need to be referred, don't be scared about the referral. Not every child that gets referred to us has autism. Sometimes we find that there is anxiety, like Lindsay said, or ADHD, or just a speech issue, and they do need therapy, but it's not autism. So, so start with your primary care. If the recommendation for the evaluation, get assessed and work with that team. And then know that if your child is diagnosed with autism or another neurodevelopmental disorder, whatever, that's not a terrible thing. That there is lots of hope and treatment options out there. And again, I hope folks will tune in to the next podcast when we talk about treatments and some of the cutting edge things that Dr. Tan especially is going to spearhead for the Arc of the Ozarks. But there's lots to be hopeful about. And you guys around the table, really are living proof of that in terms of what your kids, adult children, are doing now in terms of how they've thrived. And so I don't want parents out there thinking that, gee, if my child was diagnosed with autism, that's the end of the world. They'll never have a full and fulfilling life and find any independence or joy or whatever, because, they're working, they're living independently. Some of them, they are marrying, they are, they're enjoying all the other challenges that we all do. So
plus they've learned about a couple of resources that I didn't even know were available for adult children, which I'm excited about.
Me too.
So Dr. Tan, were you going to say something?
Yeah, just
to wrap
one
it up?
thing is that not just like the ADOS and some of the screening tools, but also there's some like autism genetic panels that are very important to emphasize too, because some of the syndromes, neurodevelopmental disorders, you may think it's autism, but it's not. But it's important to identify in the different system of organs that they can affect as well. And
it's a great point. I mean, most of us have heard of Down syndrome or Fragile X or whatever genetic-based abnormalities that could present with autism. There's a slew of unnamed genetic abnormalities that can now be assessed. And so I agree with Dr. Tan that if a child is thought to have autism or a neurodevelopmental disorder, that including some fairly simple blood tests to look at a whole genome, a chromosomal microarray or Fragile X, those kinds of things should be part of that assessment.
Do you guys do that here? Genetic testing?
We do actually. We can order the blood test for those that require it. We do some other pharmacogenomic testing that I think we'll hold on till the next conversation, because it has to do a little bit more with medication treatment. But yeah, we certainly order that, and it's probably underutilized. There's a lot of folks that, in fact, if we went around the table and I ask you all how many of your kids who have been diagnosed had a chromosomal microarray in Fragile X, some of you would say, no, we haven't. And so, So
And that's because it was through Dr. Tan.
again, he's cutting edge and he knows his stuff. So,
but
thank you.
There was a reason I also brought it up too, is because in the near future, you may be looking at targeted or gene therapies.
Yeah.
Okay. Yeah.
Great to hear.
Yeah.
Because we've all wanted research for years.
Yes.
We've wanted this research, and
Absolutely.
now it's coming around, and we're
Right.
getting to know more.
Yeah.
Lindsay, you want to take us home?
She had
Absolutely. There we go.
Go ahead.
One of the things I just want to leave everybody with is to understand nobody is alone in this fight. We're all in it together. And it's going to take a community-wide, to make the changes that are necessary for kiddos and adults alike. The world is changing, and we've got a great changing pace for it. But just know that nobody is alone. We're all in this together.
That is perfect. And you guys, thank you for all you do.
Thank
I
you.
feel even more informed and even emotionally touched that
I do too.
all the work you're doing, because I'll talk to you later about it. But I mean, I'm very grateful and thankful that it's here, even more than I thought I would be. So thank you so much. We are going to continue with all these wonderful doctors talking about medication, but we're going to wrap it up for now. And Tara, where can everybody find us?
Well, I did not write it down, so I'm
Okay.
going to look at the ceiling so I can remember everything. Okay, so we are on Apple and Spotify under Navigating Adult Autism Podcast. We are on Facebook and Instagram, and on at navigatingadultautism.com. And you can contact us at moms@navigatingadultautism.com.
Email us with questions or
Yep.
concerns. Yes. Okay. Thank you all
Thank
very
you
much.
so much.
Appreciate
Thank
it
you.
so very
Thank
much.
you.
Thank you so much.
Okay, bye, everybody.
Bye.